Hello guys, welcome back to my channel. Myself Monica, and I'm finally back with my new video after a long 2 weeks because I was having my pre-board examination. And today the video is all about my pre-board examination. So the reason I always tell the reason behind my every videos, and this video is because I personally believe that we all learn from other people's mistake. I learn a lot from other people's mistake, and I think if I will share my mistakes with you, you might learn from that, and you might not do the same that I did. I'm not saying that 100% you will not be repeating my mistake, but maybe some of you can just so it's my third year pre-board examination. We usually have four subjects in our third year. The first is the ear, nose, and throat, forensic medicine, and toxicology, then community medicine, and then next one is ophthalmology. So I'm from a Kathmandu University affiliated college, and the question paper scheme of our college is like 30 marks will be for MCQs and 50 marks there will be question paper which consists of SCQs, short answer questions, and long answer questions, and then remaining 20 marks will be given as internal marks by your teachers. Okay, so practicals marks we have 80 marks, and 20 marks will be the internal marks. So now without further ado, let's get started. So the first subject was community medicine. So I have got the question paper. So I put a little bit of stains here because of I spilled a little bit tea over my paper, but that's here. It's my question paper of community medicine. I will keep it here so that you can see. And I want to say that MCQs were really easy. It was so easy, the easiest MCQs collection. It was really easy, and that time only I thought, okay, maybe this they have decided to give little bit twist in their question paper. That's why they are giving MCQs easy, and it turned out to be the same thing because the questions were quite, I will not say tough, but very unusual kind of question. Not even, I don't know what to say, but that usually it's not like totally different, but kind of a little bit less important topics were more given in the questions or something. That those chapters which were mostly asked were not asked, and those chapters were thought to be less priority one were more focused. So in that was the question paper. So the one thing that I made a mistake, the very first is I forgot to put a tick mark on the questions that I attempted, and that I left to do it later on. So in that process I made a mistake of not doing one question number 1B, which is such an easy question. I'll tell you what the question was: importance and objectives of nutritional program in school. See, I think nutritional program in school, we all can, even even if we have not studied this, we could have, it's very easy to write it because it's what are the programs that you use for school nutrition. So there are lots of things that you can write. You can do all kinds of gossips here. But I forgot to make a tick mark. I can always see that I never put anything marks strikes on my paper, and that is the result why I forgot to do this question. It was 3 marks question, and only the other questions were really tough, and I was I didn't do them. I had no idea about this sexual deviation. I didn't study, so I could not solve this question. Then next question that I didn't study and I do not do was epidemiology of stroke. So epidemiological determinants are there, which obviously we can write, that is agent, host, and environment. But if only asked about epidemiology, then you have to write in context of country, cases and everything. So I had no idea about this, so I even left this question. And so this were the question that I left, and already I was leaving this amount of question, and even I mistakenly left this unattempted, and I was really sad. I was really disappointed. And I always think that it's so important in exam hall to always put a tick marks on the question that you have attempted, and the question that you have thought to attempt later, to put a different kind of marking there so that you will know. Because in hurry sometimes we might forget it. Obviously community medicine is a very lengthy answer writing kind of paper. So in that time you might go out of your time and you might not be able to do everything. So this was the first mistake that I did. That is, please do not forget to put a tick mark. Although I'm in third year and I should be knowing it beforehand, but still, learning is never late. And all the questions were pretty good. I will just show it over here. And this was our question paper. So you can just look it and practice yourself also, because every questions will be similar. The next paper is of your nose and throat, and I don't have ENT paper. The reason I don't have ENT paper is because, again, I will tell you what I did, and I will. So now it's for my paper 2, that was ear, nose and throat. And the reason that I don't have my paper with me right now, because I was so sad after my completion of my exam. And the reason I was very sad was, so we were asked one problem based question which was like this: a 45 years female patient presents with a history of recurrent attacks of giddiness lasting for a few hours to a day or so. The attacks are accompanied by hearing loss and tinnitus. So, what is the likely diagnosis? What is the etiology of this condition? What investigations would you like to substantiate your diagnosis? And what is the management of the disease in acute stage? So, anybody who is in third year and who have already studied, or who have already completed ear, nose, and throat, they will definitely know what kind of disease is this. But I it's a Meniere's disease, and what I wrote was otosclerosis. Why? Because I was so hurried that I just saw female, and I saw hearing loss and tinnitus, and then I wrote it otosclerosis. And I tried to cross check it. Okay, so I had my friend, I cross checked with two of my friend, and they also said it otosclerosis. And actually, they were also confused initially. So, and usually PPQ it's question number 6. So, people starts with question number 1, but I started with PPQ because I was like, I know PPQ, so I'll do it in a very good way. I'll get a really nice way. Then I will go with the short answer questions. So the first question was question number 6, that I attempted another way doing one from question number 1. So in that process I did even discuss with lots of people, and obviously it was so clear cut. Here is written about what is the management of this is an acute phase. In Meniere's disease only there's like acute phase, and then there is other phases, chronic phase. But I don't know how in my brain I thought I did not read question properly, and I made a mistake, and because of this I lost my 10 marks. Okay, this question of was of 10 marks. And let me tell you, Meniere's disease is one of the very important and one of the mostly asked topic from your nose and throat. So no student will ever do a mistake of not studying that topic. Otosclerosis is also important. So the topic that you have studied, you knew, but you didn't study. I did not study the questions properly. I don't know what hurry I was in, and I lost my 10 marks, and that hurts a lot. And that is what I did in paper 2. This is the mistake that I did in paper 2. That was your nose and throat. Other questions were pretty good, even MCQs. And I personally find MCQs of your nose and throat quite difficult to solve. So but it was good. I did it in good way. And other questions were not very difficult, they were quite nice questions. We were this time asked from year only, and everything was from year. I'll put the question here, you can see it. So that was the second thing that I did on my second paper examination. So please, first of all, look at the questions properly, look at every sub questions also properly, because in the sub questions also there are hints which you help in your solving your problem based questions. And just don't, I don't know, but it's about luck also. Maybe I had a bad luck. I even cross-checked, and they were also like the first they had written it's otosclerosis, but few of my friends they corrected later on, but I did not, because I did not ask them after later on, and we were not communicating. So yeah, that happened. So this was about paper 2. Now let's go in my paper 3. So before going to my paper 3, let me tell you what happened before I went for examination of my paper 3. So every time life is not smooth. Okay, you will not just have exam, then you will study, you'll go and give exam. Sometimes there can occur some other problems also. I was so disturbed, and I cried in the morning, and by crying from like 6 to 7 o'clock. I think maybe 7:30 I cried. Then I thought of studying. Because I was crying so badly, I forgot everything that I studied also. But the question paper was easy, like easiest question you can say. It was very easy. Like the questions were like, what is VKC, what are the different forms of VKC, what are the different treatment options for VKC, what is cornea, what are the different layers of cornea, what are the different stages of corneal ulcer. So questions were really really easy. Everything was good. So only the problem with this paper was that I was in a very disturbed mental state, and I could not focus properly in my examination, and I was in lack of sleep also. I think I just slept for like 3.5 hours, not properly. And that was also the reason, because if you don't sleep properly, you will not even be able to perform properly. And that is what happened with my ophthalmology, and the question paper will be here. Okay, after that, the fourth was forensic medicine. And in forensic medicine, we had no gap between two exams, like two days ophthalmology and tomorrow there was ophthalmology. So we had to study so many of topics in short period of time. And if I want to tell you that minor subjects, they are very very volatile. They once you will read and you will forget it tomorrow. They are very volatile. Even it's ear, nose, and throat, or it's ophthalmology, and either is whether it's community or it's forensic, especially forensic toxicology part. It's so volatile. You will study, and you'll forget it later on. So again, the mistake I did was what I did with my ENT. I made a wrong diagnosis. So the question here was. A 5-year-old boy consumed an unknown liquid by accident. About half an hour, he started to vomit and cried with abdominal pain. His mother then rushed to the casualty of hospital where you are a medical officer. After the patient presented to the emergency room, after 2 hours, you notice the patient is stiff-necked and has difficulty breathing. Chest X-ray was instructed, which revealed bilateral mottled opacities near the hilum and lower lobes. Gastric lavage was not given, but he was treated with intensive care support. What might be the likely substance consumed? Why the gastric lavage was not performed in the present case? What can be the complications of this case? How will you treat this case? List out some common household poisons with the chemical content. And I made a diagnosis of corrosives. Actually, this was kerosene poisoning. And why I could not make a most of us, we made a wrong diagnosis. Okay, there were very few people who made kerosene, because first of all, in theory, we did not, I think, study kerosene. And like it was something that our source said, study by yourself, this is small chapters. And there were other very very important and big topics from toxicology which I had studied, but I did not study it because it was one of the last and it was very small chapter, and I thought it was not even important. And because of that reason, I made a wrong diagnosis and I lost 10 marks. So I will not say it was my bad, I will say it was a bad luck first. And second thing, okay, I did not even study it in theory, so definitely I had no idea. I knew that gastric lavas are not done in like corrosive poisoning and kerosene, but sometimes you just, this also I discussed with my friends. Okay, I did not do it myself, I discussed it, and they said they are doing it corrosives, and then I did it, and again it was wrong diagnosis. So yeah, luck is never with me. After that, let me tell you one more thing. There are two PVQ questions, right? I had studied almost all, like except this corrosive and this ballistic. I did not even study ballistic. I studied other injuries and like fractures and everything, but I skipped ballistic, saying that I will not be able to complete it in this short period of time and I will leaving it. And my life is such that whatever the questions I skip, they are for sure coming in exams. I'm not even lying. They are for sure coming in exams. I'm that unlucky. Okay, any of my close friends did know this thing. So what they used to do in my first and second year was, before going for examination, they will come and ask me what are the chapters you have skipped, because they know that whatever she has not studied or skipped, that have more chances of coming in exam, and they will study those chapters like once, look at them, and they will go okay. And this has been like from my class 8 till the time I remember. This thing happening was from class 8. It used to happen every time, whatever the topic I used to leave. Like in my optional math examination also, Once I left like four questions were there which I could not solve it, and I thought I will go to my school early and I'll ask my friend and I will like learn there. But unfortunately, exam, I happened to be there late. I happened to go to my school late, and I could not discuss with my friend. And those four questions only came to my paper, like 20 marks. Out of all those book, those four questions were chosen for exam. Just think about it. And it was not like, like other questions were also there, but I don't know why I have such a bad luck. But this was it. And the questions were a little bit tough. So we were asked about uh, various other things. It was not like very difficult questions, but a kind of unusual kind of questions. And I'll put my question paper here and you can look through it. I will not go to every question paper because if I do, then it will video will be very, very long. And I don't want that to happen. So this is it. So this happened with my papers. Okay, now I will tell you what happened in my Viva. Viva part we will see in part 2. Okay.